Good morning, it's Friday and it must be time for another Bowtie briefing. Today we want to talk to you about the Health Information Exchange. Now this is something that we've talked with you extensively about. It's been a major legislative priority for us for years now in order to enable you to have the data that you need to take care of your patients better. And having it all in one place so that you can get that data transferred to your electronic health record and have that available when you're making decisions. Part of the legislation that happened this past year during the 2015 long session was moving the legacy HIE that was housed over at CCNC to a new state-run Health Information Exchange Authority, HIEA. And so we've been working closely with the new HIEA as they've been forming, working on board members, working on new provider agreements, and working on the transition from the legacy program. And today marks a momentous day because today is the day that your new provider agreements with the HIEA are due. And we have been working with them specifically on the provider agreement and a problem that was identified there by some of our members regarding insurance requirements that had not been previously required for you to insure third parties. And we got that taken out. Section 18B, if you haven't heard yet, has been stricken. It will not be enforced in the provider agreements that you're holding right now, that you're looking to sign or considering to sign and send back today. So you should be getting an amendment clause from the HIEA legal staff. You should have gotten it yesterday or today. Be sure to pay close attention to that. Add it to your agreement before you send it back in. If you've already sent your agreement back in, all you have to do is sign the new amendment and send it in, and everything will be set. So next we will be working on additional things with the new HIEA to make sure that everything is running smoothly, to make sure that you're getting the information that you need. One important process that we've been working on with them is the opt-out process. And that's where your patients might choose to not have their information available on the Health Information Exchange. And making sure that process is as administratively easy for you as possible, because we don't want another burden added to you since you're the kind of middleman in this process between the patient and the Health Information Exchange. We're also working with them to recruit additional folks. So if you're watching this video today and your practice has not chosen to link up to the HIEA, we would continue to encourage you to do that, because this is something that we see as very essential as we move to data-driven outcomes in healthcare. We think this is one way that we can get information in place that you can use on a regular basis and make sure that you have the background to prove your value, not only to the state but to other providers of insurance and healthcare coverage as well. So a great day, lots of things to come. This is also a day where the state is considering the final changes to new congressional maps. That's still very much up in the air, so we don't have a comprehensive report for you today, but we'll bring you more information about that next week and how that changes the primary elections in March or possibly June for you to consider when knowing when to go out and vote. So we look forward to talking to you again next week, and that's all for today.